Early diagnosis of hypertension in young adults. Hypertension is a major public health problem and is increasingly being diagnosed in young adults aged 18–40 years. Early diagnosis is essential because hypertension in this age group is often asymptomatic, yet contributes significantly to long-term cardiovascular morbidity and mortality. Detecting elevated blood pressure early allows timely intervention, prevention of complications, and improved quality of life. Definition of hypertension. Hypertension is defined as a persistent elevation of blood pressure, with systolic blood pressure, 130 mmHg, and/or diastolic blood pressure, 180 mmHg, confirmed on repeated measurements taken on separate occasions. Importance of early diagnosis. Early diagnosis of hypertension in young adults is important because the condition is often silent, with no obvious symptoms. Long-term uncontrolled hypertension leads to heart disease, stroke, kidney failure, and visual impairment. Early intervention can prevent or delay target organ damage. Young adults have a longer lifetime exposure to high blood pressure if undiagnosed. Risk factors in young adults. Common risk factors include family history of hypertension, obesity, and sedentary lifestyle, high salt and fat intake, excessive alcohol consumption, smoking, stress, and poor sleep patterns, underlying conditions such as diabetes or kidney disease. Methods of early diagnosis: routine blood pressure screening, regular blood pressure measurement during clinic visits, school health programs, workplace screenings, or community outreach programs is the most effective method for early detection. Accurate blood pressure. Measurement diagnosis requires proper technique, patient seated and relaxed for at least 5 minutes, appropriate cuff size, measurements taken on at least 2 different occasions, ambulatory and home blood pressure, monitoring. These methods help detect white coat hypertension, masked hypertension. They provide a more accurate representation of daily blood pressure patterns. Clinical evaluation. A detailed history and physical examination should be performed to identify symptoms, lifestyle factors, family history, and possible secondary causes. Laboratory and diagnostic investigations. These include urinalysis, serum electrolytes and creatinine, fasting blood glucose, and lipid profile ECG or echocardiography when indicated. These tests help assess organ damage and identify secondary hypertension. Challenges in early diagnosis: low awareness among young adults, misconception that hypertension affects only older people, poor health-seeking behavior, limited access to regular health checkups. Conclusion: